Hi guys, and thank you for joining me on my YouTube channel today. My name is Kendra, and as you can see from the title, what I'll be talking about in today's video is what I had to do to be approved for bariatric surgery. I have my notes down here, so you will see me look down. If you're wondering why I'm looking over here, I have my notes of everything I had to do. The first thing I did was actually find I had to find a bariatric center to where I wanted. So I literally just Googled where I wanted to have. So like I was saying, first thing I did was actually look for a bariatric place. So this, just so you know, it's going to be a process. I started in February. Today's date is June 28th, 2022. And I'm not even having my surgery till August 3rd, 2022. So it's going to be a little process. So this is the pre-part. And my center actually gave me a list of everything I had to do to before I could even be considered, even before they submitted to my insurance. And I'm going to be going over those things. So the first thing I had to do was 3 nutritional classes, which those were done with a nutritionist. This was required by the bariatric people, but my insurance actually required me to complete 7 of them. So just so you know, your insurance may require you to do a little bit more than the actual bariatric center does, but the bariatric center lines up with what they make you do, things that what they think the insurance will approve you for. So if they only tell you do 3 and then the insurance comes back and say you have to do more, they do submit things to the insurance company. So that's how I knew I had to do 7. They also made me attend 2 support groups, which the support groups is basically just every month. Online, it was a WebEx class that I had to go to. I went to a lot more than 2, but you only had to attend 2, and they just talked about different things like your vitamins. They did a class on bariatric surgery, what to do on vacation so you don't overeat. They did all different type of classes, and they send out a schedule every month, and you can just go to them, and they're on a WebEx. I also had to do a psych assessment, which is very common with bariatric surgery. Basically, you have to meet with the therapist. I was able to meet with her online on video, so that was nice. It was very convenient and talk with her, and they just make sure you're mentally ready for bariatric surgery, that you understand what you're doing. You understand that this is lifelong, can't go back, can't change it. And you know, they ask about some of your triggers or why you overeat and things like that, but they just want to make sure you're mentally ready for bariatric surgery. I also had to go to my primary doctor to get a medical clearance form. And the reason I basically just saying that I am healthy enough to have bariatric surgery. If you have other problems, like if you have sleep apnea, if you have diabetes, and other things, you will have to get signed off from those doctors as well. Luckily, I do not have those other types of doctors, so I only need to get signed off by my primary doctor. I also had to do a 5-year weight history. And that was hard because I had not been going to the doctor, my primary doctor, 5 years straight. I hadn't been, I think I skipped a year. So luckily I had my daughters within the last 5 years. So I had been weighed at the OBGYN office. So that saved me with the 5 year, but that is something hard. So basically they're just looking for a weight history, a trend that, like I think with my first daughter, I was around 220. And they just want to see like a trend in your weight, that basically you've been overweight for the last 5 years, that it's been a struggle, and that's what they're looking for with that 5-year weight history. A lot of people were asking, well, what if I don't have it? Then it's just basically, if you don't have it, you don't have it. Just move on is basically what they said. But I luckily was able to get that from my OBGYN. Any doctor can provide 5-year weight history. And just keep in mind that this is the requirements for my doctor's office, so everyone is going to be different. So I'm just giving you guys my journey and what my doctor's office required. I got my bariatric surgery at UNC Rex. I also had to get lab work done, and that's basically where they send you to a lab office. It was really convenient. You could go to any lab. UNC is all over where I live, so I was able to go into any UNC lab near where I wanted to go. Sorry about that. And basically just getting all your pre-labs and things, you know, to get your baseline, because you know with bariatric surgery it's very important to watch your labs and make sure everything's going good there. So that's basically what the lab, you get pre-lab work done. I also had to get an upper endoscopy, and just know for the upper endoscopy you do have to go under anesthesia. So I went in, my husband drove me to the office. I went in for a day, and basically they're just going down with a tube down your throat, check your esophagus. I think they also check your upper stomach, checking for problems that might be in there, like enlargement or things like that, just to make sure that that system, your digestive system, is healthy for bariatric surgery before they go in there. And I also had to get a last thing, I also had to get a gallbladder ultrasound, and that's basically just like, you know, an ultrasound. I don't know, you've been pregnant before, for the women out there, it's just like an ultrasound you would get for a baby, and they go and they're looking for your gallbladder, checking for stones, just to make sure that is fine. I've heard of quite a few bariatric patients actually get their gallbladder taken out during surgery. That is, I'm recording this before my surgery, so I don't think that is something I will have to do. My surgeon did not mention that. I didn't have any problems. Everything that I did on my list was fine, was normal. I didn't find anything except for with my endoscopy. They did find something that I got treated for, but everything else was normal. So I didn't, but I have heard with bariatric surgery that some patients get their gallbladder out. I'm not sure why that happens, or they just do it proactively or something, or if maybe they find something on the ultrasound. But that is pretty much it, is what all the things I had to do. After I did all these things, I then submitted it to the nurse that sends the information to the insurance. Then she sent it over to my insurance. My insurance was very slow. It took them about 15 days exactly to approve me. That is not, well, I don't know. I guess it is common, but you're technically supposed to give them, I think, 15 to 30 days. And it took mine 15 days before I got the call to say that I was approved. They were thinking I was actually it was gonna be quicker, that sometimes turnaround is as quick as 5 days, but for some reason my insurance did not approve me that fast. So it took about 15 days. And then I got approved. I am not having my surgery till August 3rd, 2022. That is some of my doing, but just keep in mind, I started this process in February of 2022, and my surgery is not till August of 2022. Just keep in mind that don't think that as soon as you walk in the doctor's office, you're going to be having the surgery in the next 2 months. It might take some time. I did push mine back a little bit because of, you know, personal reasons and other things, but just keep in mind that it takes a little bit of time to get all these things completed. And that is pretty much it. So if you guys have any questions or anything I can help you with, just leave it down below. I do plan to post more videos to take you guys on this journey. I am going to do a vlog my day of surgery, and in the beginning I want to do weekly updates for you guys, and then I'll probably will move to monthly updates. So please just don't forget to like this video and subscribe to the channel so you can keep getting more updates from me. But thank you again so much for watching. I'll see you in my next video.